I like to think about the mental status exam being broken down into two parts, looking at the appearance and behavior of the person, how they are expressing themselves and coming across, and then the second part about like their cognition and orientation to the environment and participation in the world around them. Mental status exam is something that practitioners do as a part of documentation to see how the symptoms are showing up for a person and how they are impacting them and how they are participating with the practitioner in treatment. Thought process. How are they thinking? Is it logical? Is it linear? Is it organized? Is it goal directed? Is it disorganized? Are they able to process through a thought effectively and have what they're trying to say be received and well communicated in the interaction with the other person? It can be disorganized or tangential, like ideas that are unrelated being developed on top of each other and shared. Circumstantial or fixated, like maybe they can't stop thinking about a particular element of something, or like in the case of paranoia or delusional beliefs, sometimes there's a fixation on grandiosity, like feeling superior, feeling like you are like a god, for example, or fixation that you are being watched or that you are going to get hurt or someone is going to kidnap you or something bad will happen to you. Thought content. What are they actually thinking about? What are they talking about? Is there any sort of evidence that they want to hurt themselves or another person? That's really important to listen for so that you can continue to talk about it with the person. And that part is being like received and understood and isn't ignored so that it can hopefully be planned around in a way that keeps the person safe and independent and able to advocate for themselves, but also at a less risk. You don't want the level of risk increasing. So you want to know if they're having any suicidal or thoughts of hurting anybody else. Thoughts. Are there repeating themes? Are you seeing notes of obsession, obsessive thinking? How do they describe their racing thoughts or their circular reasoning? How is that coming across? Are you able to understand them and follow with the information that they're giving you? Perception, like are they oriented to reality? Across different age groups, this is important with different medical or developmental situations. It's important to pinpoint the person's perception. Do they know what day it is? Do they know what time it is? Do they know where they are? Do they know what they're participating in? The same thing, young people, kids, youth. Do they know they're in therapy? Do they know what intervention is being done? Do they know why they're there? Or someone with a developmental disability, someone after like an accident or a traumatic brain injury, someone who is elderly, someone who is experiencing memory loss. Are they oriented to the environment? Are they able to participate openly in conversation? And obviously note like if they are experiencing any symptoms of mental illness like auditory or visual hallucinations or delusional thinking, delusional beliefs. Cognition. Are they oriented to the environment? Yes. Do they understand where they are in place and time? So this is, again, checking their reality. Are they participating in conversation like they are in the present moment and in the environment that they are currently in? Are they talking to you like you are their parent or their teacher or their bully? Are they acknowledging who you are? Do they understand who you are? Do they understand your role as the clinician? What's their attention like? Are they able to focus? Are they able to participate in back and forth conversation? Do they understand the social implications of what's going on? Are they able to carry on a conversation, or are you just continuing to prompt them and ask them questions? What kind of memory are they accessing? Are they talking about when they were a child? Are they only able to talk about yesterday? Are they not able to remember? Are they only focusing on the present moment? Where do they want to be talking? What seems to make them uncomfortable? And what is coming up again and again over time? Are they able to recall information effectively? Do they feel comfortable with what they're able to remember and talk about and process? Is it hard for them to remember? Do they appear like they need a long time to process it? Or they don't want to share it, or they don't know how to word it, they can't get the words out? How are they able to recall information when you are prompting? Insight and judgment. Is the person aware of the symptoms that they are having? Just like fundamentally. Do they understand their symptoms of depression or anxiety or personality disorder or developmental disability or traumatic brain injury or physical condition? Do they understand what it means to have that condition? And do they understand how their symptoms are presenting to an outside external assessor? Depending on that level of understanding determines their level of insight and judgment. Do they have insight into their mental health? Do they understand what impulse control is and emotional regulation and coping skills and caring for their physical body, self-care, advocating for themselves, boundaries? Do they understand those things? Or is that part of the treatment? Is helping somebody become more of an advocate for themselves in that way? Do they understand how this is impacting their relationship with others or their family relationships or relationships at work? Or are they just naming a pattern of like, my boss hates me, my family hates me, my friends hate me, everybody leaves me, my parents didn't like me? What is coming across in their judgment of themselves? Is it negative? Is it accurate? Is it distorted? Is it exaggerated? And that comes over time, right? You don't get all of that the first time that you talk to somebody. So you have to make observations about what they are saying so that you can compare the patterns of what they are doing and are saying over time. Because this impacts how they respond to intervention. Are they motivated to change? Are they able to change? Are they in a safe environment to change? Is their nervous system available to receive new input? Are they in a place where they can learn new skills? Or do we need to focus fundamentally on addressing immediate needs and stabilizing the situation? That determines the goals that you set. Are we focused on stabilization? Are we focused on treatment? Are we focused on management? Are we focused on increasing insight or increasing independence or increasing the ability to have good judgment? It really depends on what is said and what is observed that shapes the diagnosis that gets assigned and followed with somebody and the treatment goals that you are billing and engaging with every time that you talk to a person. So it's really important to understand how to structure a mental status exam so that you have an understanding of how the presentation actually looks for each client over time and you're able to compare it. There is more information, there's a template and some examples from the link in my bio, so feel free to check that out if it would be helpful for you to have access to the actual words that are going on in a session.